Mr. President, I can still recall the first briefing I had as a member of Congress on something called HIV and AIDS. I didn't know much about it. I'd heard the words, but I didn't understand it until this briefing brought to mind and brought to light the serious threat this was to the health of thousands of people in the United States and around the world. It was a frightening moment. The information we received led us to believe, quite honestly, this was the public health crisis of our time. I do say this, that there was a response that I was surprised by. Despite all the controversy around all the values and issues, President Ronald Reagan and his Surgeon General, Coop, stepped forward and showed real leadership. Now, some argue that President Reagan waited too long. I'm going to put that argument aside. The day came when the Surgeon General sent a letter to every American family, really telling them the threat of this public health crisis. It was the right thing to do. We dealt with it in an honest, forthright way. We appropriated massive amounts of money for treatment, for research, and we've come a long way in saving the lives of many who were threatened by this deadly disease. It's rare when a president of the United States steps up and says to the American people, we have a public health crisis. And I think because it's so rare, we should take it very, very seriously. President Obama made that plea to Congress in February of this year about a new public health crisis involving the Zika infection. Zika, of course, is borne by mosquitoes. There was evidence in countries around the world that when these mosquitoes bit someone, infected them, it could have a negative health consequence, particularly on pregnant women and the babies they were carrying. And so President Obama came to Congress in February of this year and in a rare moment announced that we had an emergency, a public health crisis that needed to be addressed. He asked for $1.9 billion to eradicate the mosquitoes and also to develop a vaccine to protect innocent Americans. I took that seriously. Unfortunately, the Republican leadership in Congress did not. It wasn't until May, some 3 months later, that the Senate passed a response to the president's request for this public health emergency called Zika. We passed a bill which had about $1.1 billion in it, not what the president asked, but a substantial investment toward his goal of protecting America and developing a vaccine. And we passed it with an overwhelming bipartisan roll call. Some 89 senators, both political parties, voted for it in May of this year. That, of course, was 4 months ago. Well, what happened after the Senate, with a strong bipartisan vote, responded to the president's request for emergency funding for a public health crisis involving Zika? What happened to that bill after it passed the Senate? It went to the House of Representatives. That, unfortunately, is where it took a bad turn. Instead of passing the obvious bipartisan bill in response to the president, the House Republicans insisted on delaying it further and adding provisions that were politically controversial and really were unnecessary to our goal of protecting America from this crisis. They added a provision that said that if you were a woman seeking family planning so that your pregnancy was not compromised by the Zika virus, you could not use Planned Parenthood agencies for those family planning consultations. Why would they pick Planned Parenthood? Because the Republican Party is at war with Planned Parenthood. Even their family planning functions, they're willing to stop. 2 million American women went to Planned Parenthood last year. They counted it for professional services that they can trust and afford. Well, the Republicans want to close it down. They've voted repeatedly to do that. And so they chose this Zika emergency public health crisis bill to do that again. They took $500 million slated for the Veterans Administration to expedite the consideration of claims by our veterans and eliminated that money in the VA, put it toward the Zika virus. Third, they decided to suspend the authority of the Environmental Protection Agency when it came to monitoring and overseeing the chemicals that were going to be sprayed to kill these mosquitoes. And finally, in the ultimate political act, they put in a provision which eliminated the prohibition against displaying a Confederate flag at a U.S. military cemetery. That is what happens when legislation that starts off very simple, very pointed, very direct, runs amok and becomes a political freighter, carrying in all of these issues. That's what happened. And of course, the Republicans in the House knew what would follow. The bill would run into resistance in the Senate and be bogged down. So instead of taking the simple funding bill the Senate passed overwhelmingly on a bipartisan vote, the Republicans complicated the situation dramatically and brought the whole conversation to a stop. So here we are today. The president's request in February, we're now in September. Congress has yet to send the president the resources he asked for. At what cost? Well, we know the cost. At this point, we estimate by the end of the year, in Puerto Rico, 25% of the people on that island will be infected with the Zika virus, including presently about 1,000 women in Puerto Rico. We know that they're in danger, that the babies they give birth to will have serious, life-threatening birth defects because of that infection. An infection that might have been slowed down or even avoided had this Congress, under Republican control, responded to President Obama's request for an emergency public health funding of this Zika epidemic. As of last week, there were 20,870 reported cases of Zika in the United States and its territories. It included 1,887 pregnant women. In Illinois, 70 of these women. We estimate about 700 or 800 women in America, in the continental United States, who have been infected by this virus. Another 1,000, as I mentioned, in Puerto Rico. I don't know if we had responded in a responsible, bipartisan way quickly when the president made his request, if some of these families and women and their babies could have been spared. We will never know. But we do know this for sure. The Republican-led Congress ignored the president's request, refused to send the money he asked for, and we are paying a heavy price as a nation, not as heavy a price as these women who sadly have a tragedy on their hands that maybe, just maybe, could have been avoided if Congress had responded in a timely fashion. 7 months without congressional action for an emergency public health crisis called Zika is shameful. Let's not wait another day. Before we leave here to go back and campaign, before each party returns home to brag about what they can achieve or have achieved, let's do our job here when it comes to this Zika crisis. Let's make sure the continuing resolution, which keeps the government's lights on, also turns on the lights at the Center for Disease Control, at the National Institutes of Health, so that we start reducing the number of people infected and also developing a vaccine to protect innocent families across the United States and perhaps around the world. That is something which we desperately need to do.